Not with that alone, but we're opiate addicts, so we shoot, around here it's fentanyl, we shoot fentanyl. And fentanyl is gonna put you out, and this is kinda gonna bring you up.
Is it hard to find that, or?
That's why you see so many drug addicts around here. It's on every corner pretty much.
What happens to a city when thousands find shelter in tents and underpasses instead of homes? Sacramento, California's capital, stands as the center of governance, yet it buckles beneath the weight of homelessness, worsened by the relentless grip of the fentanyl crisis. This is not just Sacramento's struggle. It mirrors the wider challenge of homelessness in America, where countless lives are lost to broken systems. Every encampment along the American River tells a story of hardship, but also of endurance. In this journey, we look at the roots of the crisis, the shadow of addiction, and the paths toward real change. Can Sacramento build a future where every resident belongs under a roof? Let's search for that answer together. 1. The scale of the crisis. The faces behind the numbers. Sacramento streets tell a painful story of struggle, resilience, and loss. In 2024, California accounts for nearly 1/3 of the nation's homeless population, more than 770,000 people without stable housing, an 18% jump from the year before. Cities like Sacramento, San Francisco, and Oakland sit at the center of this storm, where thousands live in tents, cars, or makeshift shelters beneath overpasses. These aren't just figures on a chart. They are human lives, each with a story. Take Maria, once a nurse and now a single mother, sharing a rundown van with her young daughter after losing her job to rising costs. Or John, a former construction worker whose fentanyl addiction pushed him to the streets, shattering his hopes of a better life. Their stories echo a wider reality. Homelessness in America is worsening, not easing. In Sacramento, public spaces that once bustled with families now hold sprawling encampments.
Well, when I first became homeless, I was camping out in front of the parole office on North 12, and right across the street from those fishes. Yeah. So that's probably where I'll be, or I'll probably be moving around because, I couldn't find a stable spot. Right. Cops would tell me to move, or, I'll be in violation of Paladin security or whatever. So.
Well, it's like hot weather, lugging everything in that you need to eat or drink, going to do laundry somewhere else, going to the bathroom. Wherever. Some people like to find the toilet outside, some dig a hole. Personally, I go to the casino and go to the bathroom. If I don't make it, I have to dig a hole like everybody else.
Concerns about health, safety, and crime divide the city. Some residents respond with compassion, offering food and support. Others, frustrated by trash and discarded needles, demand encampments be cleared. The tension is sharp. How do we show empathy while protecting order and safety? California's homelessness rate, 367 per 100,000 residents, is among the highest in the country, and Sacramento reflects that harsh truth. Families, veterans, and young people make up this diverse, unhoused population, each carrying their own story of loss and endurance. The crisis here mirrors a nationwide epidemic that challenges the very idea of the American dream. What makes Sacramento's struggle especially striking is its role as the state capital. This is the seat of government, the heart of California's decision-making, yet its own neighborhoods serve as daily reminders of policy failures and broken systems. Along the American River, rows of tents stand in stark contrast to the gleaming dome of the Capitol just miles away. The divide between power and poverty has never felt more visible. As Sacramento wrestles with this urgent issue, pressing questions remain. How did we arrive at this point, and what failed in a city once known for growth and promise? It's a truth leaders, advocates, and residents can no longer avoid. Solutions must be found, and found soon. Two, the roots of the crisis, a perfect storm. To understand Sacramento's homelessness crisis, we need to look at the collision of economic pressures, social struggles, and policy shortfalls that have left thousands without a roof. One of the biggest drivers is the lack of affordable housing. Between 2020 and 2025, median rent in Sacramento jumped nearly 20%, squeezing families already living paycheck to paycheck. Inflation and job losses in sectors like retail and hospitality only made matters worse. For many, a single missed paycheck meant slipping from stability into homelessness. This isn't just Sacramento's problem. It's part of a nationwide affordability crisis fueling the epidemic of homelessness in America. But the story doesn't stop with economics. Policy missteps have deepened the crisis. Programs like California's Home Key, which turns hotels into temporary housing, offered some relief, but the scale has been far too small to meet overwhelming demand. The 2024 Supreme Court ruling in Grants Pass versus Johnson further complicated matters, granting cities like Sacramento the authority to criminalize sleeping in public. While this ruling gives local governments power to clear encampments, it raises a haunting question. With too few shelters or housing options, where are people supposed to go? Critics argue the decision punishes survival instead of solving the problem. Social forces add another layer. Wildfires and floods have displaced thousands of Californians, many seeking refuge in Sacramento. Meanwhile, mental health struggles and fentanyl addiction trap countless others in a cycle that seems impossible to escape. Poverty and addiction feed one another, creating a loop that drags people deeper into crisis. Families who once had stable homes now face the devastating choice of living in cars, shelters, or on the streets. Sacramento's situation is not an isolated failure. It's a reflection of a national safety net too weak to catch those who fall. The challenge is enormous, but not unsolvable. Can leaders find the courage to craft long-term solutions that provide affordable housing, mental health care, and addiction treatment? And most importantly, can they do so while remembering that behind every statistic is a person longing for dignity and hope? Three, the fentanyl shadow, a crisis within a crisis. Amidst Sacramento's homelessness emergency, a darker threat lurks in the shadows: fentanyl. This synthetic opioid, 50 to 100 times stronger than heroin, has become a relentless killer, claiming lives and deepening despair among the unhoused. In 2024 alone, Sacramento recorded hundreds of fentanyl-related overdose deaths, many among those living on the streets. Cheap, potent, and easy to find, the drug has seeped into encampments along the American River and downtown sidewalks. Discarded needles and heartbreaking overdoses stand as daily reminders of its deadly grip. For many, fentanyl isn't just a symptom of homelessness, it's a driving force, trapping people in a cycle of loss and survival. Take David's story. Once a mechanic, he lost his job during the pandemic. Overwhelmed by anxiety and hopelessness, he turned to fentanyl. What began as an escape soon consumed him, and now he lives in a tent by the river, his health fading, his hope nearly gone. Like so many others, his addiction makes it nearly impossible to find work or stable housing. Emergency services in Sacramento are buckling under the weight of overdoses, with first responders stretched thin. Hospitals and clinics, already short on resources, are pushed to the brink, while police and firefighters face burnout from responding to overdose calls day and night. Residents, too, are frustrated encountering needles in parks and drug paraphernalia on sidewalks, torn between fear and compassion. Parents worry about their children's safety, while business owners struggle as foot traffic declines in areas plagued by open drug use. The question remains, how can the city bring hope to those ensnared by fentanyl while easing the concerns of its housed communities? Some efforts bring glimmers of progress. Groups like the Harm Reduction Coalition distribute Narcan and clean needles, offering life-saving support. Yet, these programs are underfunded and can only reach a fraction of those in need. Shelters and treatment centers are overwhelmed, often leaving people to bounce between the streets and temporary beds without lasting solutions. Nonprofits and churches step in where they can, but the scale of the problem dwarfs their capacity. The fentanyl crisis underscores a sobering truth. Tackling homelessness means confronting addiction head-on. Sacramento's struggle reveals a crisis within a crisis, one that demands not piecemeal measures, but a bold, coordinated response linking prevention, treatment, housing, and public health. Without such action, the city risks losing not just lives, but the very hope of rebuilding a safer, healthier community for all. 4. Current response is a patchwork of efforts. As Sacramento struggles with its growing homelessness crisis, intensified by fentanyl's grip, the city and state have rolled out a mix of responses, some showing promise, others falling short. In 2024, Governor Gavin Newsom issued an executive order requiring encampments to be cleared from public lands, a mandate Sacramento has pursued aggressively. Police and city crews have swept tents from the American River in downtown, citing health and safety concerns. Yet these sweeps, while briefly tidying streets, rarely solve the problem. People simply move to new corners of the city, often losing what little they own and what little trust they had in the system. For those displaced, the question lingers, where can they go? There are brighter spots. Programs like CalAIM use Medi-Cal funding to connect unhoused residents with housing, healthcare, and addiction treatment. Some Sacramento hotels have been converted into shelters, offering temporary refuge to families. Nonprofits, including the Sacramento Food Bank and Family Services, provide meals, clothing, and Narcan to save lives from overdoses. Still, these efforts are stretched thin. CalAIM faces possible federal cuts in 2026, shelters are often over capacity, and treatment beds are scarce. The city's approach resembles a patchwork quilt, well-intentioned, but full of gaps. At the state level, legislative efforts are underway. Senate Bill 634, introduced in early 2025 by Senator Sasha Renee Perez, seeks to protect unhoused individuals from being criminalized for survival acts, like sleeping in public, countering the Supreme Court's Grants Pass versus Johnson ruling. Advocates hail it as a step toward compassion, while critics argue it sidesteps the real issues, housing shortages and addiction. At the same time, voters approved a ballot measure in late 2024 that increased penalties for drug offenses and mandated treatment for repeat offenders. Experts remain skeptical, warning that without sufficient housing and rehab programs, such measures could deepen the cycle of incarceration and homelessness. Community responses add yet another layer. Faith-based groups and volunteers hand out food, blankets, and counseling, filling gaps government programs leave behind. But frustration simmers among some residents who point to needles and crime as reasons to clear encampments rather than expand aid. This tension reveals a central challenge, balancing public order with long-term compassion. Sacramento's efforts, though varied, remain fragmented. Without stronger coordination, housing tied to treatment and prevention, the city risks fighting symptoms while the deeper crisis grows. True progress will require not just patchwork fixes, but bold investments, political courage, and a renewed vision that recognizes homelessness not as a nuisance, but as a defining test of Sacramento's values, its compassion, and ultimately, its humanity. That means scaling programs to meet real demand, expanding treatment beds, and committing to long-term housing solutions that prioritize dignity over temporary relief. It means leaders working hand in hand with communities, nonprofits, and those directly affected by homelessness. Sacramento's crisis will not be solved by one law, one shelter, or one ballot measure. It will take collective will, honest dialogue, and the recognition that the measure of a city is found not only in its skyline, but in how it treats its most vulnerable. Five, a path forward, bold solutions for a broken system. To confront Sacramento's overlapping crises of homelessness and fentanyl addiction, the city needs more than stopgap fixes. It needs bold, forward-looking solutions. That begins with reimagining housing. Models like the tiny home villages in Austin, Texas, show what's possible. Small, affordable units paired with on-site services such as counseling, job training, and addiction treatment have helped move people off the streets and back into stability. Sacramento could adapt this approach, joining forces with nonprofits, developers, and state agencies to build thousands of low-cost units. Overcoming zoning hurdles and local opposition won't be easy, but the long-term gains, lives restored, and less pressure on emergency services would be profound. Equally vital is a stronger commitment to addiction treatment, expanding inpatient beds, increasing access to Narcan, and sending mobile clinics into encampments could save lives and connect people to care. Tailored job training for those in recovery, along with integrated mental health support, would address the deeper wounds driving both addiction and homelessness. Programs like HomeKey have shown promise, but they need more funding and better coordination to create a true safety net. Changing public perception is just as important as policy. Campaigns that remind us fentanyl doesn't define them could shift the narrative, encouraging communities to see the unhoused not as burdens, but as neighbors with untapped potential. Local businesses can be part of the solution too, by offering jobs or supporting recovery initiatives. Technology also holds promise. AI could predict overdose hotspots for faster response, while blockchain could make aid distribution more transparent and effective. Yet, none of these efforts can succeed in isolation. Sacramento needs a coordinated system where housing, healthcare, addiction, recovery, and employment programs are seamlessly linked. Imagine a model where a person moves from an encampment into a tiny home, receives on-site medical care, joins a recovery program, and then transitions into job training within months. This holistic pathway, while ambitious, is achievable if leaders break down bureaucratic silos and invest in long-term strategies rather than temporary fixes. Community buy-in will be crucial. Faith groups, neighborhood associations, and civic leaders can help bridge the gap between compassion and order, offering support while addressing residents' concerns about safety. By promoting shared responsibility, Sacramento can turn division into collaboration. Ultimately, the city stands at a crossroads. One path continues the cycle of sweeps, temporary shelters, and frustration. The other embraces bold innovation, compassion, and courage. Sacramento has the resources, creativity, and resilience to choose the latter. The real question is, will the city summon the will to act? Its unhoused residents are not statistics. They are people with stories, skills, and dreams. Given the right support, they can reclaim their lives and strengthen the very fabric of the community. 6. A personal reflection, the heart of the matter. Watching Sacramento wrestle with its homelessness crisis leaves me struck by a painful paradox. Here is a city with rich history and boundless potential, yet it is shadowed by tents, despair, and lives cut short by fentanyl. This epidemic is more than failed policies. It reflects a deeper fracture in our collective conscience. Walking past encampments, I don't just see shelters of tarps and plywood. I see stories of resilience, of dreams deferred, of potential forgotten. Statistics like 770,000 unhoused nationwide, or the hundreds lost to overdoses in Sacramento, can numb us. But one look into the eyes of those on the streets reminds us, these are human beings, not numbers. The path forward, I believe, demands courage. Courage to fund permanent housing instead of repeated sweeps. Courage to treat addiction as the disease it is, not a crime. Courage to recognize every unhoused person as a neighbor, worthy of dignity, compassion, and support. Sacramento has the resources, the creativity, and the heart to lead. The barrier isn't ability, it's political will. This crisis, as overwhelming as it feels, is also an invitation to reimagine community, to embrace the vulnerable, and to ensure no one is abandoned. The moment to act is now not out of pity, but out of moral duty. And yet, the responsibility doesn't rest on leaders alone. It rests on us as neighbors, voters, and citizens. Every donation, every conversation, every decision to support humane policies adds to the ripple of change. Imagine a Sacramento where children no longer see encampments on their way to school, where veterans find housing instead of sidewalks, where addiction is met with treatment rather than punishment. That vision isn't out of reach. It's waiting for us to claim it. True progress is measured not by the wealth of our cities, but by how we care for those who have the least. Sacramento can be the city that chooses compassion over indifference, solutions over silence. The question is whether we have the will to make that choice today. Conclusion. Sacramento stands at a turning point. The homelessness crisis, driven by fentanyl, rising costs, and broken systems, cannot be met with short-term bandages. It demands bold, lasting change. From tiny home villages and expanded treatment programs to stronger community outreach and smart use of technology, the solutions are already within reach. What's left is the choice. Will Sacramento and America as a whole embrace compassion and real solutions, or settle for blame and temporary fixes? We have the chance to build a future where no one is forgotten, where every person has a roof and a chance to rebuild their life. That future starts with us. If this message resonates with you, please like, share, and subscribe. Together, our voices can spark the change that Sacramento and our nation urgently needs.